Okay, let's unpack something truly pivotal today. It's a piece of federal workers' comp claims that, honestly, often gets missed. We're talking about the mechanism of injury, or MOI. And it's not just, what injury happened, it's about the precise how. And what we found digging into this is that for federal employees, maybe you're at the VA or USPS or TSA, this how can absolutely make or break your claim. So, what did you find about OWCP's specific demands here? What are they really looking for?
Yeah, what's fascinating here, and maybe a bit daunting, is that the Office of Workers' Compensation Programs, OWCP, well, they have a very strict requirement. They expect doctors to actually describe the physiological mechanism, that's their term, how the work event or the job duties cause the injury.
Physiological mechanism, okay.
Right. So this means vague statements like, employee was injured at work, they just won't cut it. Not even close. If that specific how isn't clearly laid out, like exactly how you lifted that box or the specifics of a fall, the medical report is probably going to be seen as insufficient.
Which leads to denial, I assume?
Directly to a denial, yeah. Happens all the time. So a clear, credible MOI is just vital. And that's true for both types of claims. There's the form CA1 for traumatic injuries, single incidents. And then there's the form CA2 for occupational diseases, things that develop over time. It's key for both.
Okay, so if that how is so crucial, does it apply the same way to, say, a sudden fall versus something like carpal tunnel that develops slowly, or do we need to think about those differently?
That's a really critical distinction. And yes, you absolutely need to think about them differently. Let's start with those sudden ones, the traumatic injury claims. Those are the CA1s.
Right, CA1. So that's for an injury caused by a specific event, something that happened in a single day or even a single work shift. Think of it like, one identifiable moment, a fall on a specific date or lifting something heavy that one time. For these CA1 cases, the MOI has to detail that single event. It needs to describe exactly what you were doing, how the injury happened right then and there. You need those crucial details, the date, the time, where it happened, and like a step-by-step of the action. We found a really clear example. On March 1st, 2025, at 10:30 a.m., while lifting a 50-pound file box from the floor, the employee felt a sudden pop in her lower back followed by immediate pain. That's specific.
Exactly that specific. And the reason it's so paramount for CA1s is, well, it establishes what they call the fact of injury. And it proves that it happened in the performance of duty. That's the legal standard. OWCP examiners, they take that MOI you described, and they compare it against the medical condition being claimed. They're looking for consistency.
Makes sense.
If that description is vague, or frankly, if it just doesn't sound plausible, the claim falters. Because where's the evidence an accident happened? Or that accident could realistically cause that injury? And it's not just a suggestion. Federal regulations actually mandate it. The physician's report has to include the history of injury as given by the employee, and it must be precise. Even for things that seem totally obvious, like, say, a worker falls off a scaffold and breaks their arm, the report still needs a brief sentence confirming the fall caused the fracture.
Wow, even for something that clear-cut.
Even then, without it, technically, the claim could be denied for lack of causal connection.
Okay, so that's the story for a sudden incident, a CA1. But what about those conditions that, creep up on you, the ones that develop gradually? How does the mechanism of injury apply to those, the CA2 occupational disease claims?
Right, the CA2s. Now, these are for conditions that develop over more than one workday. It's due to cumulative workplace exposures or repetitive tasks. So for these, the MOI isn't about one specific event at all. It's completely different. Here, it's all about the ongoing work factors. You have to paint a really clear picture of the employee's day-to-day job duties.
So less about a single moment, more about the overall job.
Precisely. Detailing the tasks performed, how often, for how long, and critically, how those activities specifically led to the diagnosed condition. We're talking cumulative trauma, like carrying a 35-pound mail satchel, walking 8 miles a day, 5 days a week for 20 years. That adds up. Or maybe typing and clicking for 6 hours every single day, leading to, say, wrist tendon inflammation. And the report absolutely has to connect the timeline too. When did the symptoms start? How did they progress, especially relative to that work exposure?
I can imagine establishing that cause and effect is, well, a whole different challenge for those gradual onset injuries, right? It's not as obvious as a fall.
Oh, absolutely. Causation is far less obvious in CA2 claims.
Yeah.
And honestly, that's exactly why the MOI narrative often makes or breaks the entire case. OWCP expects specifics. They need details about the work conditions. It's not enough to just say, the patient's job is repetitive, that's meaningless to them.
So you need numbers, quantify it.
Yes, quantify it. Physicians should put down, how many hours per day typing, what's the average weight lifted, how many times a day, how many years doing that specific task. And here's another crucial part. The doctor must address non-work factors too.
Like hobbies or pre-existing stuff.
Exactly. Hobbies, pre-existing conditions. You need to rule them out as the primary cause, or at least explain their role, if any. Because without a clear mechanism linking the disease specifically to the job duties, OWCP might just deny it. They might say it's just natural aging or degeneration. This causal explanation, really spelling out how the work duties contributed to the diagnosis, it's truly the single most important thing OWCP requires for these CA2s.
Okay, so whether it's a quick traumatic thing like the CA1 or a slow cumulative one like the CA2, the core idea of MOI, it's always about answering that fundamental question. How did the work cause this specific problem? And you mentioned it's actually a term OWCP uses themselves, like on their checklists.
Exactly. Mechanism of injury is right there on their checklist for what makes a medical report adequate. They expect the doctor to explicitly connect the dots. Connect the work activity to the medical diagnosis. And often this involves what's called biomechanical reasoning.
Biomechanical reasoning, what does that mean in simple terms?
It just means explaining in sort of simple medical language what forces or movements actually cause the physical damage, how the body mechanics led to the injury. We found some powerful examples in the materials we looked at. For instance, for a back injury, a good report might say, lifting a 50-pound particle placed acute stress on the lumbar spine. As the patient twisted, this mechanism strained the muscles and ligaments of his lower back, which explains the diagnosed back sprain.
Yeah.
See, it links the action, the force, and the result.
Ah, okay. Action, force, result, got it.
Or for a knee injury. The knee twisted inward when the worker fell, which is a biomechanical mechanism known to cause tearing of the medial meniscus. It explains how the fall hurt the knee. And for something gradual, like occupational arthritis, 4 decades of carrying a weighted mail satchel subjected the knee joints to countless cycles of loading. The abnormal overuse and heavy loading resulted in increased shear forces that led to accelerated degeneration of the cartilage." Unquote. It paints that long-term picture of wear and tear. A well-articulated MOI like these, backed up by facts and the medical findings, it just significantly boosts the chances of getting the claim approved.
Okay, this is making a lot more sense. And to really see this in action, well, here's where it gets really interesting. We pulled 3 specific case examples from our deep dive. They show exactly how these MOI descriptions are crafted in the real world. Our first one is a VA nurse with a traumatic back injury that's a CA1 claim. So picture Jane Doe. She's a 45-year-old nurse at a VA hospital. On June 10, 2025, she injures her back. It's a single incident while helping a 250-pound patient transfer from a bed to a wheelchair. The patient starts to fall, she twists and catches him, feels a distinct pop, and gets immediate intense pain. Later, she's diagnosed with an L4-L5 herniated disc.
Okay, so for Jane's claim, the MOI description from her doctor needs to capture that moment precisely. Something like this. On June 10, 2025, while performing her duties as a VA nurse, Mrs. Doe was assisting in transferring a 250-pound patient from a bed to a wheelchair. The patient unexpectedly lost balance and began to fall towards her left side. Mrs. Doe quickly lunged forward to catch him under the arms. In doing so, she lifted and twisted her torso sharply to the left to prevent the fall. At that instant, she immediately felt a pop sensation in her lower back, followed by intense pain radiating to her left buttock and down her leg. She reported having no significant back pain or related symptoms prior to this specific incident.
Okay, so that factual recount really nails the incident, what happened. But then the doctor needs that next crucial step, right? Linking that specific action to the herniated disc diagnosis.
Exactly. That's the causal relationship, the why it happened medically. The doctor needs to add their reasoned medical opinion, perhaps stating, "In my medical opinion, Mrs. Doe's L4-5 disc herniation is directly and causally related to the work incident described on June 10, 2025. Lifting the suddenly falling 250-pound load, especially while simultaneously twisting the torso, places extreme compressive and torsional forces on the lumbar spine. This mechanism of injury, a combined axial load and rotation, is a well-established biomechanical cause of acute lumbar disc herniations. The immediate onset of her characteristic radicular symptoms right after the event is highly consistent with an acute disc injury. Given her lack of prior history of significant back problems, this herniation is attributable to this work incident alone." See how that rationalized opinion directly addresses OWCP's need for cause and effect? It makes it incredibly clear for the examiner.
Crystal clear. Okay, let's move to our second example. This one's a USPS mail handler with occupational carpal tunnel syndrome, so it's a CA2 claim. All right, meet John Smith. He's 50, works as a mail processing clerk for the USPS, and he's developed carpal tunnel syndrome in his right hand. This didn't happen overnight. It came on over years of repetitive work. His job involves manually sorting literally thousands of letters for about 5 hours every shift, plus typing for another 2 to 3 hours, so constant gripping, pinching, wrist movements. His symptoms, the numbness, the tingling, they get worse on work days, a bit better on weekends, and crucially, there was no single injury event he can point to.
Right, a classic CA2 scenario. So the MOI description for John needs to focus heavily on that long-term occupational history and the nature of the exposure. It needs to paint that picture vividly. Mr. John Smith has been employed as a mail processing clerk with the USPS for 18 years. His primary duties involve manually sorting mail for approximately 4 to 5 hours per shift and performing computer data entry for 2-3 hours each workday. The manual sorting requires him to repetitively grasp and pinch thousands of letters in small packages daily using his right dominant hand. This involves constant rapid flexion and extension movements of his wrist and fingers. He reports his symptoms of numbness and tingling in the right thumb, index, and middle fingers worsen significantly during his work shifts and partially relieve on his days off. He denies any significant non-work activities, such as hobbies or sports, that involve similar repetitive hand use. There was no single acute injury reported, rather. His wrist symptoms developed insidiously after years of performing these repetitive tasks on the job.
Wow, that detailed history really quantifies the exposure, the hours, the motions, the duration over years, and it proactively knocks down those non-occupational factors too. That must be incredibly powerful for these cumulative claims.
It's absolutely crucial. You have to build that case brick by brick. And then the causal relationship ties it all together medically for the examiner. In my medical opinion, Mr. Smith's right carpal tunnel syndrome is directly and proximally caused by the repetitive hand and wrist motions required by his job duties as a mail processing clerk over the past 18 years. The mechanism of injury is chronic compression of the median nerve within the carpal tunnel of the wrist. This compression is caused by inflammation and thickening of the surrounding flexor tendons, resulting from years of cumulative trauma. Specifically, the thousands of repetitive gripping, pinching, and forceful wrist movements performed each day led to irritation and eventual swelling of these tendons within the confined space of the carpal tunnel, thereby putting pressure on the median nerve. This biomechanical process fully explains his diagnosed condition and symptoms. The pattern of symptom onset and progression, worsening with work and improving with rest, strongly correlates with his occupational exposure. He has no history of other conditions commonly associated with carpal tunnel syndrome, such as diabetes or thyroid disease, making the repetitive occupational trauma the clear primary cause. And it's worth noting, like you hinted, OWCP's own internal guidance often lists postal sorting tasks leading to carpal tunnel as a classic example. So using this kind of detailed explanation really speaks their language.
That makes perfect sense. Okay, for our final example, let's look at a TSA officer with shoulder tendonitis from repetitive lifting, another CA2. Okay, this is Sarah Lee. She's 39, works as a TSA officer, and over about a year, she's developed increasing pain in her right shoulder. Her job involves continuously lifting heavy luggage. We're talking 30 to 50 pounds, sometimes more, hundreds of times every single day, lifting them onto the X-ray conveyor belts. Like John, there was no single traumatic incident. Her diagnosis is rotator cuff tendonitis, attributed to that cumulative lifting strain.
Right, another cumulative strain injury. So again, the MOI description needs to detail that specific occupational history and the gradual onset. Mrs. Lee has been employed as a TSA screening officer for the past 3 years. A primary function of her job involves the repetitive heavy lifting of passenger luggage onto screening belts. End quote. She reports manually lifting suitcases and large bins, often weighing between 40 and 50 pounds, hundreds of times per day during her shifts. Quote, she first noticed the insidious onset of right shoulder soreness approximately 1 year ago, around August 2024. This pain has progressively worsened over the subsequent months, particularly aggravated by lifting activities at work. Quote, there was no specific one-day injury event. Rather, the condition gradually developed as a result of ongoing repetitive stress from her job duties. End quote. She is on no history of prior shoulder injuries before this onset and reports no outside activities, such as sports or strenuous hobbies, that involve similar forceful or repetitive use of her right shoulder.
So again, really detailing that specific repetitive work exposure and matching it with the gradual onset of symptoms seems absolutely key here.
Exactly. You establish the pattern, and then the causal relationship connects the dots biomechanically. In my medical opinion, the cumulative effect of repetitive heavy lifting required by Mrs. Lee's job as a TSA officer is sufficient to have caused, aggravated, and accelerated her right shoulder rotator cuff tendinitis. Biomechanically, repeatedly hoisting 40 to 50-pound bags, often involving reaching and lifting at or above shoulder level, places significant tensile stress and impingement forces on the rotator cuff tendons. Quote, "The mechanism of injury in this case is overuse microtrauma. Each lift contributes a small amount of wear and tear to the tendon fibers. With hundreds of repetitions daily, sustained over many months, the cumulative damage exceeded the tendon's capacity to repair, leading to inflammation, microtearing, and degenerative changes consistent with tendinitis. This pathophysiological process is fully consistent with her clinical diagnosis based on physical examination and imaging findings." The fact that her pain began and progressively worsened during her period of performing this intensive lifting work strongly supports the conclusion that her TSA job duties were the primary factor that accelerated and ultimately caused the tendon injury. And again, this kind of explanation aligns perfectly with OWCP's own training materials and examples for conditions commonly seen in TSA workers, which definitely helps reinforce the claim's validity.
Listening to these examples, you can really hear how getting these details documented correctly is just, well, it's absolutely crucial. Which it naturally leads to the question. For federal workers trying to navigate this complex system, can going to specialized clinics actually be a game changer?
Oh, they truly can be a huge difference. Think about a clinic like, say, Restore Muscle and Joint RMJ is one we looked at. They focus exclusively on federal workers' compensation injuries. That's their entire niche. And because of that focus, they understand intrinsically that the MOI needs to be clearly correlated to each and every diagnosis on the claim form. So if a patient comes in with multiple injuries from one event, maybe they slipped on ice and now have knee pain and back pain, RMJ's reports won't just mention the fall. They'll individually connect the knee diagnosis to, say, the twisting motion during the fall, and the back diagnosis to the impact or the way they landed. They make sure every diagnosis listed has its own specific link back to the work mechanism.
Ah, so they prevent that ambiguity. They draw a clear cause and effect map for the claims examiner for every single issue.
Precisely. They know that rule. Every diagnosis listed on an OWCP claim must be explicitly linked to the work mechanism. They live by that.
And I guess a really critical point here is something you touched on earlier, that many regular community doctors, maybe your family doctor or an urgent care clinic, they're just not familiar with the specific, sometimes peculiar requirements of federal workers' comp. So they often completely omit that crucial causal explanation, that detailed MOI, right?
They do, very often. Not out of negligence, usually just lack of familiarity. They might describe the injury, but not the how and the way OWCP needs it. RMJ, on the other hand, because this is all they do, makes it a central part of their documentation process to include a well-reasoned MOI for every case. They are effectively speaking OWCP's language right from the start.
That makes sense. And what about the patient's role in all this? Does a place like RMJ help them understand what's needed?
Yes, that's another big piece. They focus heavily on patient education. They'll actually coach patients on recalling the specifics of their incident or their daily work tasks. They explain why OWCP needs certain details, why the how matters so much. You might hear a provider there tell a patient directly, "Look, we need to document exactly how your work caused this specific injury. Getting this right is the key to getting your claim approved and getting you the care you need." It becomes a collaborative effort to build the strongest possible case based on facts.
So it really sounds like for federal employees dealing with a work injury, finding a clinic that genuinely specializes in OWCP, that understands these MOI intricacies, it can honestly be the difference between a frustrating denial based on vague paperwork and an accepted claim with a strong, clear, specific narrative that gets you benefits and treatment. It just cuts through so much potential red tape.
It really does streamline the process and improve the odds significantly.
So wrapping this all up, what's the big takeaway from our deep dive today into the mechanism of injury? It feels like it's so much more than just a bureaucratic checkbox to tick, isn't it?
Oh, absolutely. It's fundamental. It's about crafting that clear, undeniable story of cause and effect that validates the entire claim.
Right.
The core message, really, is that how you were hurt on the job is just as important, maybe even more important sometimes, than what specific injury you sustained. Providing those detailed, concrete descriptions of how the injury occurred, whether suddenly or over time, and then explicitly linking each medical finding back to that work incident or exposure, that dramatically enhances the credibility of the claim. It makes it much more likely to be approved by OWCP.
So, as you, our listeners, reflect on this deep dive into the nitty-gritty of injury claims, maybe consider the broader implications here. This whole process of meticulously detailing cause and effect, it illustrates a really powerful principle. The need for clarity, for precise logic, to build any compelling case. That's not just for federal workers' comp claims. That skill, building a robust, undeniable narrative based on how things happened, that's kind of a superpower for almost anything you're trying to explain, justify, or get approved in life. Something to think about.